Hello, and welcome to Health Literacy and Oral Health Promotion. Today we're going to talk about interventions. Interventions are planned actions that are designed to prevent disease or injury or promote health in the priority population. We're all pretty familiar with interventions, hopefully by now, because this is what we're leading up to with all of the concepts that we've gone over up until now. When we're talking about interventions, they vary in size and they address different issues. And so we need to discuss multiplicity, which is the number of components or activities that make up your intervention. We're more likely to be effective if our intervention is aimed at multiple levels of influence because multiple things affect an individual and their choices and their health status. So we're more successful if we take a more socio-ecological approach or a systems approach because few people are motivated by one single thing. And we just are multiple exposures are kind of needed in order to change behaviors. Dose is your number of program units delivered. A very simple example of dose is if your intervention is mailing out a flyer, a very simple intervention. The number of program units delivered would be the number that you're going to mail out, and that's your dose. Innovation strategies, we're going to discuss a couple of the common ones that most people use because they're evidence based, but they don't have to be evidence based. That is definitely something you want to seek for. It's very helpful, but really the sky is the limit when you're talking about innovation strategies. We'll start with the health communication strategy. Health communication strategy is defined as the study and use of communication strategies to inform and influence individual and community decisions that affect health. Health communication strategies are vast because, in reality, almost every intervention needs to include some form of communication. You can't really relay a message unless you're able to communicate that message. This is why communication strategies are useful in reaching goals and your objectives. You create an awareness of an issue and you can change your attitudes towards behavior. They also have a high penetration rate because they are seen by a lot of people and it's cost effective and less threatening to reach a large audience when you're using a communication strategy. Its limitations really are that it's not sufficient to change behavior on its own. You can't just relay a message. You generally need more in order to motivate behavior change. And the means of communication have changed. In the past, it's just been communications generally been relayed through a message from a sender to a receiver. An example is your simple commercial. In the commercial, the sender has all the power. They create the entire message, and the receiver only gets the message. They can't interact with the message, and they have no say in developing that message. And with the creation of social media, the internet, and our enhanced technological advances, there's been a need to have a more complex communication model. And one of those is the multi-directional communication model. And that kind of shows that communication is a combination. A person receives their communication from a user generated source. They can get it from a practitioner led communication, which would be us right here. Side to side sharing of messages within each other, and then their own seeking behaviors in order to develop information. So it's important to understand this. So if you're using a communication strategy, you need to be able to either understand all of the consumer tendencies and needs and their preferences when you're designing your campaign, or else you need to trust somebody who does know these different messages. Communication channels are the route in which a message is given to your priority population. Traditionally, there have been 4 levels of community channels for traditional ones, but we need to now include social media as well in our communication channels. They are hierarchical in nature in regards to the amount of people that they reach. So we'll start here with intrapersonal channels, which are the most often used, and they're generally most often used in our setting as a dental hygienist, we tend to have that intrapersonal approach. We tailor our messages, we personalize our messages specific to the needs of the individual that we're talking to. Another good example of intrapersonal communication channels is health coaching, or nutritional coaching. It's a specific message designed for a specific individual. One of the a good technique to use in health coaching is motivational interviewing. Motivational interviewing is a collaborative, person centered form of guiding to elicit and strengthen motivation for change. This is where that, open ended questions about a person kind of comes into play. Motivational interviewing is actually quite successful because one, lets the person know that you're listening to what they're saying, and it takes their own desires and goals into account when you're trying to create a plan for behavior change. I highly recommend looking into motivational interviewing more. I've taken a couple CEs myself, and they're extremely interesting and extremely effective. Interpersonal channels kind of, go from the one individual that you're communicating with and add a little bit more to that. These are your support groups and your small classes. They reach a little bit more people than intrapersonal, and they use few resources. When you get to organizational and community, this is where people receive a lot of information. You take kind of a more of a community approach to this. These are your bulletins, your agency newsletters, um, bulletin boards, and community activities. And then finally, here with mass media and social media, this is the most visible communication channel. You influence people directly and indirectly when you're taking into account mass media or social media. Mass media can be your, both print and electronic, like your billboards, your direct mailers, newspapers, television, radio stations, and magazines. It's a broad area of people with one narrow focus for your message. Social media. Social media has really changed the way that we communicate amongst ourselves. And so it kind of sets itself apart a little bit with communication channels because it's unique in the way that the information is organized and distributed. You can update your information almost immediately, and it's generally a very low cost for the amount of people that you're reaching, and you can reach a more diverse audience when you're using social media. Social media is your podcasts, webinars, your social networking sites like Facebook and Twitter, LinkedIn, your social news, your YouTubes, your social videos, and photo sharing. You really need to think strategically when you're using this as an outlet, but it is very cost effective and reaches a large audience. Let's talk about health literacy because health literacy goes beyond the grade level that a person can read. As you may or may not know, in America, on average, the seventh grade reading level is the level that most Americans are at. So when you're creating things, you do want to think about that reading level because you want people to understand what you're reading. But literacy goes beyond just being able to read what you're saying. Literacy is the ability to use that material to function in society, to achieve your goals, to increase your potential, and to increase your knowledge. And then health literacy is the capacity to obtain, process, and understand basic health information and services in order to make appropriate health decisions. So, health literacy is the ability of a person to be able to process what they're hearing, understand it, in order to make the best health decision for that person. And that goes even further when you talk about health numeracy. And this is a mouthful, is the degree to which individuals have the capacity to access, process, interpret, and communicate and act on numerical, quantitative, graphical, biostatistical, and probabilistic health information in order to make effective decisions. In this day and age, our science, it's got probabilities, it's got statistics, it's got graphs, it's got quantitative data. You need to be able to understand that data in order to make the correct decision. If you don't understand what's being told to you, then you truly don't understand what the best route is for you. So it's important to understand these things when you're developing your interventions so that you have the most success. Because after all, what we want to do is inform people so that they have a better life. And to do that, you want to make sure that they can understand what they're hearing. So now let's go into a different strategy, your health education strategies. Health education is the planned combinations of your learning experiences designed to predispose, enable, and reinforce your voluntary behavior, which is a little different than health communication, though they actually very much work within each other. There really is no clear dividing line between these two, and they're not mutually exclusive. But the best way to remember the difference between health education strategy and health communication strategy is that communication is just to inform people, it just gives them the message. While education strategies are planned learning experience that provide the knowledge and skills in a more formal education setting. These are classes, seminars, workshops, face to face, and sometimes even online. The best example is CPR courses. We have to take them. Some people don't take them in the healthcare setting, but they're there. They're education, and they give you knowledge in order to change your behavior. It's important to understand how adults learn in order to be successful in these kind of strategies. And it's also kind of good to understand learning principles like curriculum and unit plan. Curriculum is a planned set of lessons or courses designed to lead competence in an area of study, and they have a scope and sequence to them. If you want to take, for example, this BAS program that you're in right now, you have a curriculum, which is all the planned set of courses, all those courses that you're taking, and they're in a specific sequence. So that would give you the material presented in that specific sequence. And the scope is the depth of the material covered in each one of those courses. A unit plan is an orderly, self contained collection of activities that are designed to meet a set of objectives. These are your lesson plan and your lessons. You start with a written outline of a lesson, and then you develop your lesson, which is the amount of material that you're actually going to present. The next strategy that we're going to talk about is health policy and enforcement strategies. Health policy and enforcement strategies include those executive orders, laws, ordinances, regulations, those kind of strategies. What's common to all of those, even though they're all a little different, what's common to all of them is that the decision needs to be made by somebody of authority, and they need to set specific guidelines to influence behavior that generally involve some kind of standard or requirement. And sometimes that includes your incentives and disincentives. Um, it mandates a particular response from those governed by it. And so when you're talking about this, it's important to think again about autonomy because anytime you mandate or demand some kind of law, you take away a little bit of an individual's freedom. And here in America, that's a very big motivator is autonomy. Americans are generally less concerned with what the government will do to benefit them, and they're more concerned on what the government's doing to control them. This is an important concept because when it comes to public health, we're generally trying to benefit people and we're not trying to take away their control. We're just trying to create a better community, and that better community benefits everyone on so many levels. One of a good example of this when you're talking about laws, safety belts and helmet laws. So when you want to talk about helmet laws, each state has their own different helmet law, and it has to be voted in by us, the citizens. And so autonomy always comes into play because people feel, and they do, have the right to be able to make their own decisions about whether or not they should wear a helmet. But it's statistically beneficial to have a helmet law. In states with motorcycle helmet laws, fatal accidents involving those who are not wearing helmets are at about 13%, compared to, let's say, Colorado, which is 63 to 69% of fatal accidents involve those not wearing helmets. And this is because we have no helmet law for those above the age of 18. And there are states that have no helmet law at all, no matter what your age is. So to have fatal accidents, motorcycle accidents, be at 13% in one state and then 63 to 69% in another state, that's going to give you a big difference in cost, in finance, and in rehabilitation and in health for your entire community. And that cost runs in the millions to almost billions of dollars. So it's kind of one of those lines. You want to have a good strategy so that people understand that you're not trying to take away their rights, but you're trying to protect them and create a better, more successful community. Environmental change strategies focus on removing a barrier within the environment. And that change strategies aren't characterized by just the individual or the physical environment. They can include your service environment, which is your access to care, economic environment, cultural environments, psychological environments, and even political environments. Environmental change strategies do have a close relationship to your health policy and environment strategies because there are times when a policy change is necessary in order to improve the health of the environment. A good example of this relationship would be in Healthy People, once again, as I probably bring up all the time because I do love it. One of Healthy People 2020's national goals is to increase access to healthy and fresh foods in low income areas. It is shown and proven that access to better and fresh foods in areas will promote better health and decrease obesity rates, especially in children. So, Denver's Healthy People 2020 initiatives has a specific initiative on increasing access to fresh foods in lower income areas. And you may have noticed if you've been downtown, an increase in whole food stores, an increase in farmers markets, and a large increase in community gardens. And this is specific governmental policy for this specific initiative. And it is proven to be successful and is very helpful. So, this is an environmental change because these areas have now access to fresh foods, but it needed that health policy in order to be initiated. Health related community service strategies include services, tests, treatments, or care to improve the health of those in your priority population. This requires action and participation of your target population. You need to be able to reduce your barriers, understand the resources of the population, and the consequences. Be responsible for those consequences. Here in Colorado, we have through Channel 9 their I just blanked there for a minute. Then in Channel 9 we have their free days where they have open areas for people to come in and get tested. And this is a great example of your health related community service strategies because it does require your population to come in, but they've created an area that reduces the barriers. It is free and they're all over the community. They're not just in one specific area, they have them throughout in many, many different areas. And they understand the resources of their population. They also do a really good job of the consequences. If you're going to screen people or test people for various diseases and illnesses, you have to be able to provide them with referrals or follow-up care if you find that they have one of these issues. You can't just screen people for oral cancer and say, oh, that looks abnormal, see you later. You have to give them the ability to get that tested and diagnosed and taken care of if you're doing a health related community service strategy. Community mobilization strategies, we're going to get into this a little bit more in our next section as well, but it involves community organization and community building as well as advocacy. Community organization is the process by which community groups are helped to identify common problems or targets and then mobilize their resources and develop strategies. The community is organized to help with the initiative. Community building is an orientation to practice focused on community. Rather than a strategic framework or approach, you focus on building the capacities of the community and not just fixing a problem. You give them the tools to create and enact change. Advocacy is the process in which the people of the community become involved in the institutions and decisions that will have an impact on their lives. And health advocacy deals with health issues specifically. Some other strategies, and there's a couple of them in your textbook, and feel free to explore them, are behavior modification activities, which are techniques to help those in the priority population experience a change in behavior. This involves, social cognitive theories and stimulus response. And you take a specific behavior that you either want to increase or decrease, and you focus on that. Organizational cultural activities take into effect the culture's values, beliefs, and practices and creates activities that either change those or use those to help view that better health. Incentives and disincentives, you're using a positive reward or a negative reward in order to influence behavior decisions. You may have in your work employment or know somebody in their work employment that has one of these strategies, where if you do certain wellness activities or get certain checks or tests, your health insurance decreases or you're rewarded, either with more time off or various incentives. And then your social activities, these are your peer groups, where you get together with people who are going through the same things or support you, and they help to change your behavior. So, when you're creating health promotion interventions, it's really important to look at these 8 specific um, characteristics. There's a lot that goes into originally doing behavior and then therefore changing behavior. So, you want to kind of follow these characteristics in order to be successful. You want to make sure that you address one or more risk factors because, as we've talked about, we're multidimensional and we're not always motivated by one specific argument. You want to have a theory driven behind what you're doing, and you want to use the best possible evidence. You also want to adhere to your ethical standards, and you want it to be appropriate to the culture that you're trying to enact change within. And you want it to be consistent with professional criteria, as well as an efficient use of your resources. And you always want to have an evaluation. Evaluation is really important, whether it's formative or summative, and we'll get into that later on. But you want to evaluate your program while it's going on and after it's done so that you can change within it as it's being implemented, but also so that you know what works and what doesn't work. When you're planning an initiative or an intervention, I'm sorry, you have 3 choices. You can either adopt a health promotion intervention, you can adapt an already a health promotion intervention, or design a brand new one. When you're adopting a health promotion intervention, it's really important to be able to ask yourself, has this intervention been successful in regards to your problem and your population? Has it been successful in multiple settings? Do you have the same resources and are the environments the same? And if they're not, then you're probably going to want to adapt that health promotion intervention. In adapting a health promotion intervention, you want to adapt it to the circumstances specific to your priority population. The CDC's Division of HIV and AIDS has developed a draft guidance to adapt interventions to help you. And it talks about assessing, involving your target population, implementation, and intervention. There's more information in your text to get into if that ever is where you're at as far as adapting a health promotion intervention. But if you are going to design a new health promotion intervention, there's a couple questions that you really need to ask yourself to make sure you're designing it correctly. The first is what needs to change and where is that change needed? And this goes into your needs assessment, your goals and objectives, and all that information that you've gathered. What do we need to do in order to improve the health of this community? And then you need to ask at what level of prevention will the program be aimed? Are you looking at changing primary interventions or secondary or tertiary? What level are you need to be focused on? And then what level of influence will your intervention be focused on? Are you going to use your intrapersonal level, interpersonal level, or social media? What level of influence do you need? And what types of intervention strategies are known to be effective? What's been successful in the past? What does the evidence show about the effectiveness of various interventions to deal with your specific problem? This goes into that best practice, best experience, and best process. So, always when you're doing anything, you really want to have that best practice information. This is your recommendations that have scientific backing of the highest credibility, systematic reviews, that critical research. best experience are innovation strategies that just haven't gotten that research yet. Their potential is there. There's promise in them being effective, but they just haven't gotten to that best practice yet. Then you have your best process, which is kind of falls in that expert opinion. A really great example we have is in the big flossing debate, Flossgate, where everybody, we just don't have the evidence of interproximal cleaning as far as the level of best practice. It doesn't mean that it's not effective. It just means that we don't have the scientific research to get there, which means that if you're doing an innovation strategy, you may have to use your best process information. You want to use the best practice information, but all you might have is the best process. An expert opinion isn't non credible, it's just not the highest level. You also want to ask yourself, is the intervention an appropriate fit for the priority population? You want your research to show that sorry about that. You want to know that people feel that this information is relative to them. People do pay more attention if they know that this is going to affect them. So does this intervention fit with your population? And then do you have the necessary resources available to actually implement this intervention? And then you want to ask yourself, would it be better to use an intervention that consists of a single strategy or multiple strategies? Single strategies are generally easier and less expensive, and they do have value, but there's a lot of advantages to a multiple strategy. When you use multiple different strategies, you're hitting different levels of influence, which gets your message to a variety of different ways, and that can appeal to the different learning styles within your population, as well as the different cultural values within your population. And then you hope that at least one of these appeals to your population. So that is it for now on interventions.